If you have knee pain from a meniscus injury, these are the exercises that I would recommend to heal it at home and eliminate pain. Your meniscus is a pad of cartilage that cushions and stabilizes your knee joint between the tibia or shin bone and the femur or the thigh bone. You have two of them, one on the inside, that's your medial meniscus, and one on the outside, that's your lateral meniscus. Injuries to this area typically come from two main sources. They can be traumatic, this is common in sports, accidents, injuries, things like that, or they can be atraumatic, degenerative in nature, meaning that cartilage just kind of wears out over time. In either case, the right exercises performed the right way can help that meniscus to heal and help eliminate pain in your knee. Those are the exercises that I'm going to share in this video. I hope you get massive, amazing benefit from this. I hope your knee feels better. Now, it's crucial that I mention that these exercises are for conservative care only. That means you have not had surgery and you are trying to avoid surgery. These are the exercises that I would recommend that you do. If you have had surgery recently, you must follow the protocol outlined by your surgeon and physical therapist for your safety and for maximum benefit. That said, let's jump in. Our first priority is to increase range of motion in your knee. It should go all the way straight and it should go all the way bent with very little pain. This is the exercise progression that I recommend to help get us there. The first thing we're going to work on is extension, or straightening the leg out completely. To do this, you're going to need a belt or a towel or a sheet or a rope. I have a stretch out strap right here. It's got these nice handles on it, but basically what we're going to do is loop that around your foot and then lie down on your back. Now, I want you to try to extend your knee as much as possible. That might be kind of painful for a lot of people to start, but even to just hold it in this position, that's a pretty good stretch to the back of my knee. As your tolerance improves, what I want you to do is use your hands to pull your foot up towards the ceiling, keeping that knee as straight as possible. The higher we go, the more we're gonna get a stretch right here back behind the knee, even kind of lower right here into the hamstring muscle. We're gonna take it to a point where it's comfortable, hold it for about 20 seconds, and then repeat that 3 times. And that's a stretch you can do a couple of times a day. As passive motion improves, we want to move into more of an active range of motion exercise. Here's how we like to do that. I have a foam roller here. If you don't have a foam roller, use a large rolled up towel. You're going to get the same effect. Now, with the injured leg extended, I'm going to simply put that foam roller underneath my ankle down here. This is a pretty good stretch to get it straight. Hopefully this isn't causing pain anymore. But now what I can do is actually fire my quad muscle right here on the top to try to push my knee down towards the floor, or down towards the table. I would hold that for 5 to 10 seconds and then relax. You should again feel a good, comfortable stretch right here on the back of the knee. Bonus with this is we're also getting some good quad strength there as well. And so 5 to 10 second holds, repeat that for about 20 to 30 reps. To work on the flexion range of motion, I would also start with a passive flexion exercise. Lie down on your back, and then what we're gonna do is basically give our knee a big hug as much as you can. And so right now you'll see that I have a decent amount of bend in my knee, and that's where we need to start. Even just light, gentle pressure right here on the top can increase that knee flexion. I don't want it to be painful. It can be a little bit uncomfortable, it can feel like a good stretch, but if it's painful, we've pushed too far, we need to back off of it a little bit. Ideally though, as you continue to do this, we're going to be more and more aggressive as we get more and more range of motion. So to do that, I'm going to come down here lower on my shin to the point where I can actually pull my heel in towards my backside to increase the degree of bend in that knee. And hold it in a comfortable position for 20 seconds and then repeat that 3 times. The active flexion progression to that exercise would be a heel slide. You're gonna do this, well, there's a couple of ways you can do this. We can do it on a hardwood floor or a tile floor with a sock on our foot or a towel down on the floor. Or if you have a carpet or a rug, you can put a paper plate down and then put your foot on top of that. That helps to decrease the friction between those surfaces. But what we're gonna do here is slide our heel out straight and then use the hamstrings to pull the heel as far as you can up towards your backside. The goal being to get it all the way up for a full bend in that knee. Hold it for a couple of seconds at the top, and then we're gonna return it out flat again, and then pull up, and we're gonna repeat this about 20 to 30 times. Strength exercises for meniscus rehab focus on those muscles that actively move your knee, so your quadriceps and your hamstrings, and passively stabilize your knee, so your hips and your calves. We're gonna start with the quadriceps. The simplest way to do that is with a quad set exercise. You're going to sit with your knees extended. Now really simply what I want you to do is fire this quad muscle right here on the top of your leg. Try to push your knee down into the table or down into the floor, and we're gonna hold that actively for about 5 to 10 seconds, and then go ahead and relax. Really try to contract, really try to smash that quad while we're down in that contracted position. Hold 5 to 10 and then relax. I recommend that we do about 30 reps of that. Now, as that gets easier, what I want you to do is work into a straight leg raise exercise. We're still gonna do that same quad contraction, so we're gonna really smash that quad, really good contraction. But now what I want you to do is actively lift that heel up off of the ground about 12 to 18 inches, and then slowly return right back down. And what you'll feel with that is just one more kind of level of contraction into that quad muscle. Try to keep your legs straight, knees should be nice and extended as we're holding that nice contraction right up here. 3 sets of about 10 to 15 is what I typically recommend. The beginning exercise for the hamstrings is going to be a hamstring bridge. And so lie down on your back with your knees bent, put your heels down on the ground. First step is to push into the floor or dig your heels down into the floor. You should feel these muscles right here behind your thigh kick on. Those hamstrings become active as you dig with your heels. Now hold that position as we lift our hips up towards the ceiling. Hold 1, 2, 3, and then return back to that starting position. Great way that we are isometrically training those hamstrings, meaning it's a safe position because there's not a lot of motion occurring. That's a great way to introduce strengthening into those hamstrings. 3 sets of 10 to 15 reps is what I recommend there. As that becomes easier, we can actually start to include a little bit of motion with that, with the addition of an exercise ball. And so now I'm going to lie down on my back. The ball is underneath my legs, or underneath my feet. In this position, well, beginner level would be to actively contract the hamstrings to come up and back into this spot right here. Most people are really tolerant to that. The next step to this would be to lift your hips up towards the ceiling. And now, same exercise. I'm gonna pull those heels right up into my butt and then slowly return right back to that starting position. And again, here we're going through motion, meaning your knee is bending. It becomes a better contraction at working those hamstring muscles. If you can tolerate it, that's what I would recommend. 3 sets of 10 to 15 on that one. To get into the hip stability exercises, the one that I like to start with is going to be a side-lying hip abduction. This is such an important muscle group. We're going to work the glute med and the glute min, kind of these lateral hip abductors with this. So important in stabilizing that knee joint. And so you're going to lay down on your unaffected side. Your affected side is this one, so this is gonna be my right leg in this demonstration. Knee is nice and straight, my left leg is bent, but what I'm going to do is use these muscles right here to pull that heel up towards the ceiling. I even like to give the cue, I want you to pull your heel towards the ceiling and behind you. And you're gonna feel that in these muscles right up here. And again, about 10 to 15 reps is a great number to shoot for. Nice and slow and in control that whole time. Be sure not to let it flop back down to the ground, nice and in control. Once that becomes easy, the progression here would be into a side plank. And so what I'm going to do now, it's my affected leg that's down. And so if I wanted to strengthen this left side, I'm on my left elbow, and then I'm going to pop up onto the outside of my left knee, or excuse me, on the outside of my left foot in this tall plank position. This is a great way to work these obliques, but we're also working a lot of those hip abductors as we get up into this position. Bonus, if you want, we can actually do some hip dips, so let that fall, and then use all those side muscles to push your right hip, or to push your top hip up towards the ceiling. And so if we're holding statically, typically I recommend about 20 to 30 second holds repeated 3 times. If we're performing these hip dips, I would do about 10 reps and then repeat that 3 times. One of your calf calf muscles actually crosses your knee joint in the back, and keeping this area strong is a great way to add stability to your knee. The simplest way to do that would be with some heel raises. I like to start on the flat ground. What we're going to do is contract the calves to lift the heels up off of the ground, hold 2 to 3 seconds, and then slowly return back down to the starting position. Repeat that 15 to 20 times, and then do that for 3 sets. Most people can tolerate that pretty easily. What I like to do is progress into a deficit heel raise, where now the balls of my feet are up on a stair. And so my heels are down below the level of my toes, and then the mechanics look the same. I'm going to contract my calves to lift my heels above the stair or above my toes, and then slowly return right back down to that starting position. And again, about 10 to 15 reps, repeated 3 times, is a great number to shoot for. I hope you get great results from these exercises. Thank you so much for watching.